What can independent practices learn from how health systems might be managing the crisis and these burdens?
Well, I think the first thing I'd say is standardization, standardization, standardization. I think sometimes independent practices can be victims of uh, the lack of standardization because it is a combination of several physicians that all perhaps might be running their own institutions within the larger group practice. And so the one thing that I think uh, health systems tend to aspire to do well, whether they end up doing it well or not, is to standardize. So I would say that would be one. The second is, I think, a clearer understanding again of that core versus chore. That I think is a discipline that not just health system owned groups, but larger group practices or larger enterprises tend to apply anyways. The third thing would be how to set up vendor partner relationships in a financially aligned manner, such that neither of the two parties are taking too much risk in the process of building, this sort of co-managed type of infrastructure, if I may call it that. And then I think the other piece that's interesting there is also many physician groups are sitting on what I call implicit intellectual property that actually is monetizable. Best practices that they're doing that could be useful for the rest of the industry, but they really don't have the commercial or the technological wherewithal to take that internal IP and in a formulaic manner convert it into an asset that could then be monetized across the industry by bringing it to other players in the industry. And I think health systems have shown the ability to do that, where they take these internal assets and convert them into actual third-party service providers or third-party technology providers. I think that's another piece that perhaps smaller group practices could learn from larger group practices, be them health system owned or independent. On the flip side, I'd add one thing, which is as we've worked through large group practices across the country, we have worked with about 35,000 physicians across 35 odd large groups, each of them having an average of 1,000 odd providers. One thing we've learned is oftentimes many of the independent group practices actually have a much more acute focus on efficiency than some of the large health system owned practices. And so actually I'd say there's also something for the health system owned groups to learn from the smaller groups, because in the smaller groups, the doctors treat the money like their money because they're not employees, they're co-owners. Whereas in the large health system owned groups, they can be employees. And so I'd say that the clear focus on efficiency would be one thing that actually health system owned groups could actually learn from the independents.